Hello, everyone, and thank you for taking the time to listen to my quality improvement project, which is going to be focused on reducing triage nurse overload and burnout in the emergency department. So, my name is Tony Green, and I am an emergency room nurse. My focus is going to be on the overload and the burnout, and this issue affects not only nurses, but it also affects patient safety and just the overall efficiency of care delivery. In many emergency departments, including the one that I work at, the workload for triage nurses has become overwhelming. It's not uncommon for one nurse to triage 150 to 200 patients a day. It's just kind of insane. The kind of pressure leads to burnout, errors, and, of course, delayed care. Research shows that fatigue and cognitive overload are linked directly to higher um, error rates, and in the emergency department and emergency setting overall, according to Angus 2025. When we're exhausted, decision making becomes harder, and that directly impacts patient safety. Moving on to the problem. The core issue is simple. One triage nurse cannot safely and efficiently handle that many patients. This situation could lead to missed or delayed assessments, increased call-ins, and overall dissatisfaction. As Murphy 2022 points out, burnout is not just about long hours. It's about the disconnection between a nurse mission to care and the system's ability to support the mission. My goal is to reduce nurse burnout and improve triage accuracy by improving staffing, the workload, and the motivation. Moving on to root causes. When we look deeper into the causes, they fall into a few main categories. Staffing shortages create unsafe nurse to patient ratios. Workflow is inefficient due to poor documentation systems and space management. Environmental issues like overcrowded triage areas and doctors working out of the triage rooms make things worse. And then finally, poor communication and collaboration can slow down care. All of these factors combine to overwhelm triage nurses. Aim and objectives here. The aim of this project is to improve workflow efficiency and reduce nurse burnout by at least 40%. To achieve this, I've set a few specific objectives. First, to add a second triage nurse during peak hours, along with that start nurse that they have. Second, to reduce the average triage time per patient. Third, to cut down on nurse call-ins and triage errors. And finally, to introduce incentives and recognize programs to encourage nurse retention. When nurses feel supported and appreciated, they're more likely to stay and perform at their best. Measures and evaluations. So to measure success, we'll track both process and outcome measures. Process measures include the number of patients triaged per nurse and the average door to doctor time, according to NICE 2021. Outcome measures include nurse call-in, documentation accuracy, and satisfaction survey results. By comparing these between and after the interview, we can see whether the changes actually improved workflow or made the nurses feel like they were supported. Next is intervention plan. The main intervention includes adding that another triage nurse during those high volumes, which immediately balances the workload. Also designating private rooms for doctors to keep triage stations clear and organized.